Assalamualaikum. With the new topic of the protein synthesis inhibitor, I am discussing the Quinupristin and the Dalfopristin. These both are the streptogramins. It is available in the ratio of the 13:70 as seen in the picture. It is used in the VRE. Its mechanism of action, it disrupts the elongation by the binding to the different sites on the 50S ribosomal subunit. It is bactericidal with a post-antibiotic effect. It is bacteriostatic for the E. faecium, not for the E. faecalis. It is inactivated by the plasmid-associated acetyltransferase. Have excellent choice for the intracellular organism. Why? Because it penetrates into the macrophages and produce their action intracellularly. So it is a best choice for the intracellular organisms. It is hepatically metabolized and excreted in the feces. Its ADR is venous irritation and the hyperbilirubinemia. It is the inhibitor of the cytochrome P450. So if administered with drug that metabolized by this pathway, it lead to the toxicity. Next topic is clindamycin. Clindamycin is the lincosamide used for the gram-positive bacteria, Bacteriophagialis. Side effect: diarrhea. Contraindication: it is contraindicated if the patient having the history of colitis and antibiotic associated colitis. Precaution: avoid MI injection because it is painful. Next drug is Fidaxomicin. Act on the sigma subunit of the RNA polymerase. It having the brain deficit. It inhibits the bacterial transcription and protein synthesis inhibitor. Narrow spectrum of activity against the gram-positive aerobes and anaerobes, having activity against staphylococci and enterococci, having bactericidal activity against C. difficilis. Minimal systematic absorption, so it is ideal choice for C. difficile infection which occur in GERD. Use in caution in patient having the macrolide allergy because it is macrocyclic antibiotic. Its ADR is hypersensitivity reaction including angioedema, dyspnea, nausea, vomiting and abdominal pain. Next topic is chloramphenicol. Chloramphenicol bind reversibly to the 50S peptidyl transferase. This mechanism is similar to the macrolide. Rapid and complete oral absorption, can be given orally or IV. It is distributed in the body compartment including CSF and it is conjugated in the liver. Pharmacokinetic: majorly excreted by urine, bile and feces also. Dose decrease in the newborn. Therapeutic use: it is used in the bacterial meningitis, alternate to the beta-lactam drug, penicillin-resistant pneumococci and the meningococci. Topical ear and eye preparations, conjunctivitis, otitis externa, serious rickettsial infections. Children, if the children having the age less than 8 years where tetracyclines are contraindicated, then the drug of the choice must be chloramphenicol, earlier used to treat the typhoid fever. This is a baby and having the symptom of the gray baby syndrome. This is the major ADR of the chloramphenicol when used in children. With the continuation of the chloramphenicol, its ADR is gastrointestinal disturbance, that is nausea, vomiting, diarrhea, oral and vaginal candidiasis, bone marrow disturbance, dose related, and it is reversible, decrease in the RBC production and so on. Its toxicity is gluconoride conjugation, dose 50 mg per kg per day, and it can precipitate out gray baby syndrome as shown in the picture previously, causing vomiting, hypothermia, gray color baby collapse. It can also precipitate out the superinfection. Its major drug interaction: chloramphenicol inhibit macrosomal enzyme that metabolize drug. Chloramphenicol static antagonize bactericidal drugs that are penicillin and aminoglycosides. So it is contraindicated with these two class of the drugs. ADR of the chloramphenicol, that is a mnemonic big super hypersensitivity reaction, and the full form of the mnemonic added in the description. Thank you so much. Here the topic of the protein synthesis inhibitors are ended. Thank you so much and thanks for watching.